Hi, I'm Mark De Simone. I am the Chief Executive Officer of Aegate, the leading medicine verification company in the world. In the next few weeks and months, you will be called to make a very important decision about the medicine verification system in your country. If you are a manufacturer or an association that represents manufacturer, whether branded or generics, if you're a wholesaler or your association, if you're a pharmacy or the association representing pharmacies, or if you're a regulator, a healthcare provider in the country, or a payer, you all participate to this very important decision. The National Medicine Verification Organizations in your country is being formed, and you will need to choose for one of the three providers that have been called the blueprint provider. Now, in making this decision, the most important point that you need to consider, and I'd say this is point number one, is what is the character, nature, and experience and expertise of your service provider? Have they actually rolled out a medicine verification service in countries? Have they had the experience of connecting thousands of pharmacies or scanning millions and billions of scans and tags? At Aegate, we have done this for the past 8 years on an operational basis and for the past 10 years as a company. Our company is completely focused on medicine verification. Therefore, we have done it before. We've done it before in multiple European countries with 18,000 points of dispensing in pharmacies and hospitals. We have done it using countries that had already serialized, so we know what the process of reading a serialized tag. We've also done it by integrating our work with the stakeholders in those countries. So when we come to you, we don't come to you with a theory, we come to you with a practice. We've done it for 8 years, over 3.3 billion medicine tags. We verify today 2.5 million tags a day. And with that kind of volume, we know exactly what it takes. Also, we know all the things that will go wrong. You need to be sure that the service provider actually can guarantee that all of the little issues and big issues that will occur, whether the internet goes down or the pharmacy scans the product twice in the same pharmacy by mistake, or whether there is a true recall or a true falsified product, that they've seen how the system operates. They also have a way to work with the authorities, whether it's the NMVOs or if there is a need to go to the regulator, how they could work to ensure that information is prompt. We've done it before, and when you work with us, you can rest assured that our overall price includes all of the integration with all of the pharmacies as well as the hospitals, because that's where a lot of important medicines get dispensed. Also, by giving you a flat price, you don't have to go and understand all of the nuances that will need to be addressed when putting together a system of this nature. With Aegate, you have the only proven solution provider that has actually done medicine verification for the past 8 years in 3 different countries, large and small, with different degree of complexity, and are able to guarantee to you, together with our partners that are the patient medication record companies, that the project will be within the time limits and the budget. The second issue that you must consider is the service that my service provider enables me to deploy actually meeting the stringent requirements of the Falsified Medicine Directive? The delegated acts require that the performance at point of dispensing is not visibly impacting the workflow of the pharmacist or the person working in the wholesaler or the hospital pharmacy. If you think about it, this is about 300 millisecond round trip. If your service provider does not guarantee that that performance can be sustained over billions of medicine packs, then you're not going to be secure that the system actually operates. Now, what happens if all of a sudden pharmacists have to wait for 1 second, 2 seconds, maybe have to scan twice? All of that will make the system not usable against the stringent requirements of the Falsified Medicine Directive. So ask yourselves, has my service provider demonstrated that they can actually execute to the Falsified Medicine Directive specs? Not the theoretical ones, but the practical ones. The third issue you need to consider and look at the service providers is, have I considered all the variables to ensure that I bound my cost structures? And are there hidden costs that are not clear? For example, what happens if I don't have an end-to-end system, if I don't measure the performance integrating in the software of the pharmacies, if actually something doesn't work in the authentication system? Well, the pharmacy software providers say it is not my responsibility. The service provider for the authentication database will say it's not my responsibility, and the issue will fall through the cracks. That means they will create cost for the National Medicine Verification Organization. And because this is a very specialized system, you don't know how many calls or what the percentage of issues you're going to have when you actually have different multiple provider services. So one of the questions you need to make sure that you understand is, what are the hidden costs in this system? We at Aegate have given a complete cost that includes all of the integration, all of the insurance that the system actually works, and all of the support costs in one flat cost, including the hospitals, which is a very, very complex matter. The last thing is, what is the mission of the company that is going to serve us? Have they done this before? Is this a side business to their main business, or is this their only business? And this is very important because they need to be ready to execute deployments in 33 European and European Economic Area countries. Has my service provider created the situation whereby I can start tomorrow and begin the deployment? At Aegate, we are ready for you. In fact, we have built our readiness in the last 10 years. We have been waiting for this moment, improving our performance, understanding all the issue, what happens when the internet goes down, what happens when the pharmacy scans twice, what happens when there is a recall, and have built a very precise machine to ensure that we work with you in your deployment of the service. Aegate has invested almost 100 million euros in the last 10 years to deliver you a trusted, credible medicine verification system for your country. We are unique. In the final analysis, in choosing the service provider that will accompany you in the journey to prepare this medicine verification system can live up to the expectations of eliminating your risk and keeping the cost in the boundaries that you require. For this, there's only one choice: Aegate. The phone numbers of the people to call are on our website. Each of our staff is completely focused on medicine authentication, and their job is to ensure that your success is guaranteed. Looking forward to working with you in the next few weeks and months, and to have a very successful medicine verification system across Europe in the next few years. Thank you.